Symptoms usually alert us when something is wrong with our body.
But we should not always wait for warning signs because there are diseases that do not have, or at the very least have vague symptoms at the early stage of the health condition.
Among these so-called silent killer diseases are those that affect the liver, and today we'll find out more about them.
We'll try to answer all that you need to know about liver conditions because the more you ask and talk, the better we, your doctors, can help you. Remember, your health depends on you and me. I'm Dr. TIONGSON, pitching in for Dr. Oyi Balburias.
And I'm MARICEL LAXA-PANGILINAN, and it's time to
Talk to Doc.
Doc JJ, we don't
Yes,
know
Maricel.
much about the liver compared to the kidney and the heart. Can you tell us exactly why this organ is very vital and what it does for our body?
Okay, you know, Maricel, the liver is like a woman. We cannot live without them. Well, in simple terms, the liver is it's like a refinery. So it cleans the body, it detoxifies the body. Because we take a lot of food, no, most of them processed, no, unnatural. Then we take a lot of vitamins and supplements and medication. So the liver cleans all the metabolites of the body, okay? And the liver is also a sort of a factory because it produces vital nutrients and chemicals that the body needs, like proteins and cholesterols, no? So it's very important, and we will die without the liver.
So those are the bodily functions that our featured patient today had the risk of losing, but was able to avoid. Let's find out why.
During the 1970s, whenever Flora Sese felt something in her body, she would have her checkups at the ABM-CSON Hospital, now known as the Medical City. Today, in her senior years, she has already been diagnosed with having some of the signs of aging: diabetes, hypertension, and high cholesterol level. A year ago, she felt another pain in her body.
Medyo naramdaman ko na para sumasakit dito sa akin liver. Ay, hindi ko pa nga alam na liver noon eh. Sumasakit.
Flora's cardiologist, Dr. Eugene Ramos, referred her to hepatologist Dr. Eternity Labio for further diagnosis. She was then found out to have cirrhosis and cancer of the liver.
Meron nang nakitang tumor sa liver ko. Kaya medyo ninervous ako. But wala akong magagawa, nandun na yun. So, kailangan gamutin ako. So, nagkaroon kami ng conference nila Dr. Labio, ni Dr. Ramos Santos Ocampo, kung anong gagawin sa akin. Yun nga, pinag-usapan namin yung treatment.
Dr. Labio offered the transarterial chemoembolization and radiofrequency ablation treatments to cure her cancer.
Nung una, natakot pa ako kung ano, hindi ko alam kung anong gagawin doon. But in-explain sa akin ni Dr. Labio na huwag ako mag-alala.
With Dr. Labio as her attending physician, along with other specialists, she underwent these medical procedures.
Nung dinala na ako sa Medical City at gagawin yung procedure, okay naman ang resulta sa akin at hindi ako masyadong nahirapan. Although may konting effect sa akin, medyo may masakit. But nakayanan ko. Gusto kong gumaling eh. Siyempre, kailangan yun.
Today, she still sees Dr. Labio for regular checkups and medications.
Doon sa huli naman, nakita naman niya na maganda ang pero nung matapos yung aking CT scan, itong huling CT scan ko, natuwa naman sila at ako din natuwa dahil lumiit yung aking tumor sa liver.
Now at 72, and although there are other ailments striking her body, she looks at life in a positive manner, the best way she knows how.
Lalo ka magsaya, maging maligaya ka at pimi kang smart. Kailangan pimi kang ayos at nang hindi ka lulugo-lugo. Kasi ibabaksak ka niyan eh. Yung ganyang sitwasyon mo, alam mo nang meron ka ng cancer eh. Hindi ko may cancer ka eh. Wala, hopeless ka na.
Well, I think the story of Miss Cece underscores the importance of seeing your doctor regularly. Right, Doc?
Right, Maricel. It's a positive twist in this case because her doctors discovered her liver condition early. Add to that the fact that cirrhosis is one of the silent killers. So she would not have felt anything serious even her liver was under attack earlier on.
Well, we may often hear about cirrhosis of the liver, but I'm sure there's so much more that we need to know about it. So stay tuned because after this break, we'll talk more about this condition.
Keep it here. Talk to Doc. We'll be right back.